This medication is a man-made antibody used to treat various types of cancer. It works by blocking a certain protein, vascular endothelial growth factor VEGF, thereby decreasing the blood supply to the tumor and slowing tumor growth. This monograph is about the following bevacizumab products: bevacizumab, bevacizumab-adcd, bevacizumab-awwb, bevacizumab-bvzr, and bevacizumab-maly. When you receive Avastin 25 mg per milliliter intravenous solution vascular endothelial growth factor, VEGF, monoclonal antibody, it will be administered by a healthcare professional through a vein. The first dose usually takes about 90 minutes, and if you tolerate it well, later infusions may be given over a shorter time, either 60 or 30 minutes. While receiving this medication, you may experience infusion reactions. If you have symptoms such as difficulty breathing, flushing, severe dizziness, nausea/vomiting, shaking, or chest pain, it's important to tell your healthcare professional right away. They will monitor you closely during the infusion and may adjust the speed or stop the infusion based on your symptoms. The dosage of Avastin 25 mg per milliliter intravenous solution is determined by your medical condition, weight, and response to treatment. To get the most benefit from this medication, it's important to use it regularly. You can mark the days on the calendar when you need to receive the medication to help you remember. Some common side effects of Avastin include dry mouth, cough, voice changes, loss of appetite, diarrhea, vomiting, constipation, mouth sores, nausea, and headache. If any of these side effects persist or worsen, it's important to inform your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they have determined that the benefit to you outweighs the risk of potential side effects. Many people using this medication do not experience serious side effects. However, it's crucial to seek immediate medical attention if you experience serious side effects such as fast heartbeat, symptoms of heart failure, signs of infection, muscle cramps, yellowing of the eyes or skin, difficulty urinating, signs of kidney problems, high blood pressure, symptoms of blood clots, or serious bleeding. In rare cases, Avastin may cause slow or poor wound healing, serious skin and tissue infections, or a condition called PRES, posterior reversible encephalopathy syndrome. If you notice any unusual symptoms, it's important to seek medical help immediately. Additionally, if you experience symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek immediate medical attention. This is not an exhaustive list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed here. Before starting Avastin, it's important to talk to your doctor or pharmacist about any allergies you may have or any medical history you possess. Be sure to inform your healthcare professional about any recent surgeries, injuries, or medical procedures, as well as any medications or herbal products you are currently using. It's important to take precautions to avoid getting infections, as Avastin can make you more susceptible to them. Stay away from people who have easily spread infections, and be cautious with sharp objects and contact sports to lower the risk of injury. If you are an older adult, you may be at greater risk for certain side effects, so it's important to discuss this with your healthcare professional. It's also important to note that Avastin can affect fertility in females, so be sure to consult your doctor for more details. If you are pregnant or breastfeeding, it's crucial to speak with your doctor about the potential risks and benefits of using Avastin. This medication may harm an unborn baby, so reliable forms of birth control should be used while taking Avastin and for 6 months after the last dose. Breastfeeding is not recommended while using this medication and for 6 months after stopping treatment. When taking Avastin 25 mg per milliliter intravenous solution, it's important to be aware of potential drug interactions. These interactions can affect how your medications work and increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Avastin is sunitinib. Always consult with your healthcare professional for personalized advice. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of overdose may include a severe headache. Throughout the course of your treatment with Avastin, it is important to undergo regular lab and medical tests to monitor your overall health and response to the medication. These tests may include blood pressure monitoring, urine tests for protein, kidney function, bilirubin levels, and complete blood counts. It's crucial to attend all scheduled medical and lab appointments and consult your doctor for further information on these tests. Be sure to take each dose of this medication exactly as prescribed by your doctor. If you happen to miss a dose, consult your doctor or pharmacist immediately for guidance on when to take the next dose. This medication is administered in a medical facility and is not intended for home storage. It is usually given by a healthcare professional through an intravenous infusion. The frequency and duration of the treatment will be determined by your healthcare provider based on your medical condition. Be sure to follow their instructions carefully. This medication is used to treat various types of cancer and certain eye conditions. It works by slowing the growth of new blood vessels, which can help reduce the spread of cancer cells or improve certain eye conditions. The dosage and timing of the medication will be determined by your healthcare provider, so be sure to consult with them for the best course of action. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.